hardest part of adopting your child? I work as a NICU nurse at our small hospital downtown. 3 months ago, a baby girl got dropped off at the ER. No name, no note, nothing. Just a newborn with drugs in her system who needed serious help. The moment I saw her, something just clicked. She was so tiny, barely 5 pounds, with these dark eyes that seemed way too aware for someone only hours old. I started picking up extra shifts just to be near her. I'd bring in little knitted hats, whisper songs while she slept, make sure her feeding tubes were perfectly positioned. My coworkers started calling me Mama Nurse as a joke. They thought I was just being nice because nobody else wanted to take care of her. Drug babies are tough cases, you know? They cry a lot, they're hard to comfort, and most people assume they'll have problems down the road. But not me. I saw this perfect little girl who just needed someone to love her. When the state opened her case for adoption after 3 months, I applied immediately. My colleagues were shocked. They thought I was just doing my job, being professional. But I'd already decided in my heart that this baby was mine. The interviews went fine, the home visits were okay, and I passed all their tests. But here's the thing nobody tells you about adoption. There's this rule that you can't tell anyone you're adopting a specific child, especially if you work at the hospital where they're staying. They want to avoid conflicts of interest or whatever. So I had to keep working my shifts, taking care of her, charting her progress, while my coworkers had no idea I was about to become her mom. That was torture. The worst part was listening to everyone talk about her future. Dr. Walsh kept saying she'd probably never attach properly because of the trauma. The social worker mentioned how hard it would be to find a family willing to take on a drug-exposed baby. Some nurses even joked about how the poor kid would probably end up bouncing between foster homes. I had to stand there, checking her vitals, adjusting her blankets, nodding along like I agreed with them. Meanwhile, inside I was screaming that she was perfect, that she was going to be fine, that she already had a family who loved her more than anything. The day Dr. Walsh suggested we prepare the baby for long-term institutional care because the adoption wasn't moving fast enough, I nearly lost it. I excused myself to the bathroom and cried for 10 minutes. She was talking about my daughter like she was already broken. When discharge day finally came, I couldn't tell anyone where she was going. I just helped pack up her tiny clothes, made sure all her paperwork was ready, and watched the social worker carry her out. No baby shower, no congratulations, no celebration. Just me pretending to be a professional nurse, saying goodbye to another patient. 2 weeks later, I brought Emma back for her follow-up appointment. My coworkers were confused at first, then shocked when they realized this was the baby they'd been caring for. Janet from day shift actually asked if I was fostering her temporarily. When I told them I'd adopted her, the room went completely quiet. Dr. Walsh looked embarrassed, probably remembering all the things she'd said about attachment issues. The social worker who'd been worried about finding placement just stared at us.